We begin by knocking on the patient's door and wait for a response. Before entering, I have already reviewed the medications for my patient on the AMR, making sure I had the correct time, the correct dosage, the correct patient, the correct route, and making sure that the medication was of a good date and not expired. Upon entering to the patient's room, I will begin by introducing myself. I would say, "Hi, my name is Maria and I'm a student nurse at Laredo College. I will be administering your medication today. Is that okay?" Upon consent from my patient, I will continue on by performing hand hygiene, in this case, adding hand sanitizer, and then donning my gloves. While donning my gloves, I will begin to identify my patient. I will ask the name and the date of birth. Next, I will continue by asking the patient if she has any allergies to any medications, always remembering to follow the patient's 7 rights. As well as before administering the medication, I will perform an assessment in case any medication that I have already revised has or can contribute to any changes of or altering of results. And of course, remember to clean your stethoscope before and after coming in contact with the patient. To administer medication via the oral route, we will begin by placing the medication inside a little cup like this and giving it to the patient, as well as a glass of water, and standing by the bedside making sure the patient swallows her medication. And then, if the medication to be administered is buccal, then we will place the pill right here in the cheek pocket and instruct the patient to close their mouth to allow the pill to properly dissolve. If the medication is sublingual, then we would ask the patient first to lift up their tongue and place the medication right here inside the sublingual pocket. And the same, instruct the patient to close their mouth to allow proper dissolvement of the pill. Administer medication via the nasal route. We will begin by informing the patient to blow her nose and make sure we are clear of any mucus. Next, we will place the drops inside the patient's nostril, making sure not to touch inside the nose, but always making sure that the patient does not have any pain of his neck, back, or shoulders, and is capable of performing these sort of positions of the head in order to administer medication via the nasal route. The position of the patient's head will demonstrate which sinuses we are trying to reach. For example, the posterior pharynx, we will tilt the head backwards. The ethmoid and the sphenoid sinuses, we would tilt the head backwards as well as a little bit to the side. And the frontal and the maxillary sinuses, we would tilt the head to the edge of the bed or a little to the side. And after administering the medication via the nasal route, we shall remember to let the patient stay in the supine position to allow proper reachment of the medicine into the sinuses. To properly administer medication via the otic route, we will begin by instructing our patient to recline and turn their head to the opposite ear that will be administered. We begin by observing the ear and checking for no cerumen or discharge from a ruptured eardrum. Make sure to warm the eardrops appropriately by rubbing them against your hands like so. By doing so, we will prevent dizziness for the patient if it is administered cold. We then proceed by lifting the helix of the ear up and back in order to expose the ear canal, making it easier to access the point where the drops will be placed into. To administer medication via the optic route, we will begin by observing the eye of any pus, discharge, free of debris. If anything is present, we will get a clean tissue and wipe from the inside out like so. This can be done by the patient or by the nurse. Gently pull down the bottom eyelid, exposing the conjunctival sac, and by making sure we don't touch the patient's eye, we administer the eye drops into the sac, like so. We remind the patient to blink, and we give them a tissue in case they need to wipe any excess. If the medication is in an ointment form, we will lower the bottom lid and administer the ointment beginning in the inside of the part of the eye towards the outer part of the eye, making sure not to touch the surface of the eye with the tip of the ointment, and instructing the patient to blink and reminding them about any blurriness that might occur, but to keep blinking in order to distribute the ointment evenly throughout the eye. And again, remove any excess with a tissue. Remember to document all the medication that was given, the dosage, the time, and who was the person to administer this medication to the patient. We will doff the gloves and perform hand hygiene. Before leaving the patient's room, make sure the bed is to the lowest position, the side rails are up, and the call button is within reach.